Hi moms, welcome to Baby Destination. I'm Richa and she's Shalini.
Hello.
So we are doing this live at our Baby Destination's office. And today we have with us Dr. Namrata Sandhu.
Hi.
She is a practicing gynecologist at Army College of Medical Sciences. Thank you, doctor, so much for joining us. This live is about topic is UTI and vaginal infection. This is in association with PFAS, which is about maintaining intimate hygiene. And so we're gonna talk. We're gonna take up questions. So please post your questions, any queries that you have around this topic. So doctor, we were doing the survey and we found out that 1 out of every 2 women will suffer from UTI once in their lifetimes. Is it true?
Yes, urinary tract infections is very common, especially in the reproductive age group.
Okay.
And also in towards menopause, because that's when the estrogen levels in the body start to dip. So that is another reason why urinary tract infections are quite common in that age group.
Okay. Okay. So what is vaginal infection?
So I guess the medical term would be vaginitis, which basically means inflammation of the vagina, and which is caused because of vaginal infections. Now it is a little difficult to diagnose because there are a number of vaginal infections and all of them present with similar signs and symptoms. So the patients will have similar complaints, but it could be a different vaginal infection. We have a number of them. So it becomes a little difficult to treat, and that is the reason I suggest that if somebody has a vaginal infection, they must show to a doctor and take proper treatment for it.
Okay. So when is it that they start, when is it that they should visit the doctor? Like when should they diagnose that, it's like a problematic state?
Yeah. So that is, so what people need to really understand, what women need to understand is that vaginal discharge is something that's normal. So women of childbearing age groups have vaginal discharge, but there is, but this discharge should be clear. It should be odorless, not associated with any itching or burning micturition. So when you pee, it should not hurt, and the discharge would be clear, not offensive, not associated with any itching. So if any of these symptoms appear, that means the color of the discharge changes from yellowish to greyish white in color. If it's associated with itching, if there is burning micturition, then when you pee it hurts. So all those are signs and symptoms that you should probably consult a doctor.
So whom should they go to? To a gynecologist?
Yes. Also, one more thing I would like to clarify here is that what women should understand is that so the vaginal discharge which is produced is actually a way to cleanse the vagina. So vagina is not so this discharge is not always a problem, right? Only the characteristics I mentioned, when it becomes yellowish in color or greyish white in color, it's foul smelling. You feel the urge to itch or scratch yourself, and the urination becomes painful. That's when you should go and consult a doctor. But otherwise, vagina has a way to cleanse itself naturally. So this discharge, which is basically produced from the cervical glands, when it gets mixed with the these formated vaginal cells and the certain bacteria which are there in the vagina, this discharge is produced, which is normal. So only if you have these symptoms, then you should probably consult a gynecologist and get yourself treated for it.
So is there a difference between a vaginal infection and a UTI? Because we keep hearing these terms.
Yes, so both of them could coexist. Sometimes what happens is women do not realize, so they just feel that whenever they go to pee, it burns. They have a burning sensation. So they could actually not be having a urinary tract infection. It could be a vaginal infection. Because if you do a urine routine and culture, there is no growth seen there. But if you do a per speculum examination, you find vaginal discharge. And what happens is that if you take history in detail, we often realize when we interact with our patients that they'll give you the history that when they're passing the urine, it doesn't hurt. But once towards the end of urination, it begins to burn. It's what happens is when the urine comes in contact with the inflamed skin in the perineum, that's where it hurts. So when the urine trickles down over the inflamed skin, and this inflammation has happened because of the discharge, it burns. So it's not urinary tract infection, it's actually a vaginal infection which has caused the skin to become inflamed, and when that urine trickles over that inflamed skin, it hurts.
Okay.
So sometimes it can be misleading.
Right.
People will not know. But otherwise, there are two different entities. Urinary tract infection is also very common, especially in women because of the one anatomy. Women have a shorter urethra, so the chances are more common. And also certain conditions like diabetes or whenever your immune system is compromised, chances of urinary tract infections go up during pregnancy. So there are a lot of conditions where chances of, and even if you have multiple sexual partners, intercourse, all those increases your chances of contracting urinary tract infection.
Is menstruation one of them?
So during menstruation, if you maintain proper hygiene, then you can really bring down the.
So what are the steps that they should be following, like especially during menstruation?
So during menses, what's very important is one, that you must change your sanitary napkins or tampons, whatever you wear, every 4 to 6 hours, depending on your flow. If you have really heavy flow, you may even need to change it every 3 to 4 hours. That's very, very important. Second thing is always wear cotton panties. And even normally, whenever you're using cotton panties, you must change them twice in a day. Third, try and avoid using perfume sprays locally. So don't use perfume sprays or those perfumes. Don't spray them near that area. And avoid using harsh soaps. If at all you have to. So I think. Like I mentioned before, vagina has a natural way to cleanse itself. You ideally do not need anything. You just lukewarm water is enough to clean the area. And douching is not recommended at all. We should not, vagina douching is not something that should be done. In fact, it adds to the risk of vaginal infections. So
Which is very common.
Which is very, very commonly done, and people, especially in old days, they would use baking soda, or they would use it for vaginal douching. It's not really recommended. In fact, it increases the risk of vaginal infections. All you need is water to clean the area, and in case you need to use an intimate wash, then you must make sure that it is hypoallergenic, soap-free, and lactic acid based or lactoserum based intimate wash which should be used, because our natural pH of the vagina is acidic, and soaps are generally alkaline, so we should avoid using them.
And also using public toilets. So I think using those spray sanitizers.
So we do have these PSA which come into the market, which is quite alright to use, because it kind of reduces the risk of transmission.
Okay. And then it should become like a practice, and people should, use it.
That's why I avoid using, especially people who are prone to. It's also some people are more prone to UTI, so they should try and avoid using public toilets.
Right.
And if at all they have to use, be safe as a safe option.
Right. And what is it with kids? So we have a lot of queries coming up that kids, my child is 11 months old, 6 months old, and there's redness around that area, they have itchiness. So is it vaginal infection that they are facing, or what is it?
What happens is, some babies could, because of the estrogen influence from the mother, so in the immediate neonatal period, some babies could have a little bit of vaginal discharge, which is basically because of the estrogen influence from the mother. But if it persists for a very long time, and in case it's associated with a lot of redness, you must show to a doctor. Doctor's opinion is definitely required there. And also, I mean, some women use diapers, and the babies don't get time to breathe.
Right.
That is why so it's very important to let the child breathe. So for our own safety and for our own not safety but convenience, we use diapers. It becomes very convenient for us. But it's not very.
So is it advisable while diaper changing, they should clean that area,
clean it with water. Clean it with water. That's the best way to clean it.
That's dry.
And dry. So it's very, very important that the area should be cleaned with water and should pat it dry. So it's very the most, I think, the important way to keep vaginal infections at bay is to keep the area clean. Use water. We don't need to go for fancy soaps or perfumes. We just need to clean it with water and keep it dry. That's the safest way.
We also get a lot of questions when older women ask about vaginal infections and UTI.
Especially UTI.
But
yes.
you mentioned menopause as a reason.
Yeah, so that is the reason basically, because what happens is at extremes of age. So during menopause, what happens is your estrogen levels come down. And that is the reason during pregnancy also, because the estrogen levels are high.
So what are estrogen levels, if I may
So
ask?
it's a hormone in the body,
Okay.
which begins to dip. The levels of the hormone begins to dip during menopause.
And during pregnancy also?
No, during
No,
pregnancy
during
they're
menopause it's
a little higher. That
higher.
is the reason sometimes your vaginal secretions are more. But it's basically because of the estrogenic influence. There's nothing wrong with it.
Right.
So again, so discharge needs to be treated only if it's becomes pathological. So sometimes with high estrogen levels, and also you must have seen during the menstrual cycle, during the different phases of your menstrual cycle, the consistency of the discharge is different. Sometimes during the beginning of the cycle, towards the end, you will find the discharge is thickish. It's a little thick in consistency. And then during your ovulatory period, it begins to become thin. It's thin. So that's a normal variation. There's nothing wrong with it. So people keep coming to us and they feel that there's a problem, but it's a normal change in the consistency of the discharge, which happens because of the fluctuations in the hormone levels. And there's nothing that you really need to do about it. It's not a problem.
Okay. And anything special like they should be taken care of, especially during menopause, to avoid UTI?
So I think one thing which is actually good for your health also, you can try drinking apple cider vinegar with lukewarm water in the morning, which is normally naturally also good.
I think that's recommended for everybody.
That's recommended for everyone.
Okay.
That's actually good. It also tries, and some people also like to have curd, which is supposed to be rich in probiotics, lactobacillus. But there are no studies which really support it. But my personal experience, I mean, it's actually good for the for your
So a healthy diet basically really
Yeah,
helps.
so a healthy diet. You must take a healthy diet, and be active and wear cotton undergarments. Change them twice in a day. Drink plenty of fluids because it helps you flush the toxins.
So these are more like the preventive measures.
Preventive
What
measures.
if, when to see a doctor? Like what if I have a UTI?
So if you have, if you really think that that there is a problem, like let's say if you're for vaginal discharge, as I already mentioned, if it's foul smelling, if it's associated with itching, there's a lot of burning down there, or if there is, and also if this discharge is associated with fever and chills, then you need to go see a doctor.
That happens?
Yeah, yes, it happens.
Okay.
And it could be, it requires treatment, because sometimes if you don't treat such infections, it can result in pelvic inflammatory diseases. And those diseases have consequences because they can cause ectopic pregnancies, they can cause infertility in women. So such things you need to see a doctor, a proper doctor.
Because I'm sure
That's
a lot
very
of
important, I
Yeah,
think,
yes.
that you should avoid any kind of home remedy. I think no home remedies is
So
recommended.
you must show to a doctor. If you have
Right.
discharge and you feel it's not natural and it's pathological, you must show to a doctor
Right.
and take it from there.
I'm sure a lot of women will sort of procrastinate going to see a doctor when it
Right.
comes to a vaginal infection.
Yeah.
But yes, you must.
But it should not be. It should not be ignored.
Right.
Especially if you have discharge and it's associated with menstrual bleeding. Sometimes maybe in the middle of the cycle or somewhere. I mean, when it's not your normal menstrual cycle and you have bleeding associated with vaginal discharge, you must go and examine.
Is it a particular weather during which this vaginal infection occurs, like rain
So-
season or something?
Yes. So what happens is if it's because this is common knowledge that if it's because if you wear tight undergarments, very tight jeans, and it's damp, the area does not you don't let it breathe.
Yeah.
So the chances of fungal infections increase.
Right.
Not only vaginal discharge, but also in and around the thighs.
Right.
So those chances also go up. So that is the reason
Choose
clean
cotton
and
and
keep it
loose.
dry.
Right.
That's
And
very important. Loose fitting garments. Yeah. So you let it breathe. That's very important.
Okay. So let's take up some
Yeah.
questions.
So one is actually about pubic hair. Is it a good idea to remove hair because they also they act as a
So if I have to answer that question, the capacity of a doctor, I would always say clipping is the best way.
Okay.
Because hair, people don't realize is a way, it's protective in nature. It protects your skin from a lot of infections, and using ways to remove the pubic hair sometimes result in micro trauma, and we don't even realize it. And these abrasions increase the chances of infection. So it can cause problems.
Okay.
So the ideal way is to clip it, but if you really have to use hair removal techniques, then I would just say be safe.
Right. So the next question is, I always feel the urge to pee, but doesn't feel like the bladder is cleared properly. Immediately feels like going again, but nothing comes out. Any clue why? What are the remedies? What is it?
So something like that, maybe it could be the beginning of an infection, it could be the beginning of a urinary tract infection. So ideal thing is first drink lots of fluids, and maybe start your day with apple cider vinegar or lemon juice, or so something like that. And then if it doesn't improve, then you need to probably get yourself tested, get a urine sample, urine routine, urine culture done, and then go ahead with it.
Okay. There's another question, and I've heard this before. After pregnancy, I was advised to drink less water, and that was the reason I got UTI. Is there a specific reason we should be drinking less water?
I went to the same. So my mother-in-law, she used to give me this bottle of water, and I was told like
Nothing more than that.
Yeah, actually, I was told like that you cannot drink more than this, like this entire day. So is it something that we follow, or why is it?
No, I don't think so. That's a myth. Because you should drink as much water as you need to, because your body tells you. Actually, your body is the best answer for everything, because your body tells you that you need food, you need water, you need you feel thirsty. So there's no logic to that, and you must drink plenty of fluids.
Right.
So it's more of a belief than anything scientific.
And especially once you've delivered the baby, because for the initial 6 weeks you also have a discharge which is called lochia, and it's important to maintain, to be hygienic and try and clean the area properly. Whenever you clean the area, you must clean from front to back, and not the other way around, so as to keep the infections in bay. And so if you practice good hygiene, I'm sure it's life is easy.
Okay. And I just had one other doubt. So if kids, like you were mentioning, if they have that redness or they have pain in their urine and while peeing, so should they be also going to the doctor?
Yes, if the problem persists, I do not recommend home treatments at all. You must show to a doctor, because an expert opinion is required.
Pediatric or a gynecologist?
So you could show to a. So it depends what age group.
I'm talking about kids around 6 months to maybe 2 years, 3 years. Right?
So you need to take to a pediatrician.
Okay.
And sometimes, if they're not able to deal with it, they send it to a gynecologist. If they feel an opinion is required.
And is this something that UTI is very recurrent, like it comes back again and again?
Yes. So that's what like I mentioned, that in conditions like people who have immunocompromised state, like diabetes, or they're on certain medications. Some people have this problem of recurrent UTI, and that is the time when we sometimes put them on a medicine for a longer period of time as well. So that needs to be seen, and sometimes we need to put them, even in pregnancy, some women keep having urinary tract infections, and we put them on a tablet also for a prolonged period of time sometimes. So that is why an expert opinion is required, and we need to see whether it's actually UTI or if there's a discharge associated with it, what is the exact problem. So certain tests are advised, and based on that we put them on medication.
Okay.
This is very, very informative.
Yeah, we got a lot of information, and I thank you so much for coming and being part of this. Thank you, moms, for watching this, and thank you, PSA, for organizing this entire thing. Thank you, Shalini. So, bye guys, and if you have any questions, you can still ask them. I'm sure we can ask Dr. to answer them. So please keep on asking your questions. Thank you so much.